Assalamu alaikum. Tuned into Unity FM 93.5 here in Birmingham. What a lovely month that we're going to have of fasting, and some wonderful shows happening here on Unity FM over this blessed, beautiful month of Ramadan, alhamdulillah. Opening our first show in Ramadan, talking about mental health today, which is a very important topic to be discussing. We're specifically going to be talking about perinatal mental health today, which is around the time of babies, but of course our experts here in the studio will describe that and explain that more as we have our conversations today. So we have a wonderful team here in front of me, all lovely smiling ladies here, so eager to be able to help you and make sure that you have the correct information and are able to look after mums and dads that may need the support in this crucial time. I'm going to first pass over to one of our lovely guests. This is Dr. Elizabeth Penny, who is a clinical psychologist, mashallah, but you can explain yourself a little bit more to us.
Thank you. Assalamu alaikum.
Walaikum salam.
Very nice to be back. I'm really excited to be here today to talk about my passion, really, which is perinatal mental health. We're really, really fortunate in Birmingham because we now have 3 new teams that are specially helping women in the community. So this is for all our women who are experiencing emotional difficulties with regard to their pregnancies or when they've got little babies. I'm part of one of these new teams, so it's a new job for me. I'm a clinical psychologist, so that means that I'm really interested in how people are functioning emotionally, really, about people's mental health and how to help them cope the best that they can with life's difficulties. And we know one of the most big difficulties is having children. Really, it's a very stressful time for women and for men, for families in general. My role is really to focus on the emotions, and that's what I'll be talking about today. My previous work has been with women who have been experiencing unwell babies, but here really we're talking about when things are difficult for mums and how that impacts on the whole family.
Wonderful. And as we have lots of changes happening in Birmingham and all of these new services and new teams and these changes, it's really important that we get that information across today in this show to our listeners so that they can spread that word. And we're going to introduce now Dr. Saba next, who is a psychiatrist also working in this field for a long time.
Hi, I'm Saba Ahmed. I'm one of the consultant psychiatrists working in the east side of Birmingham. So like Kathleen was saying, there's been an expansion and there's been development of new teams, and there's actually 6 of us consultants working across Birmingham and Black Country. So myself and one of my other colleagues, Dr. Jelena Yankovic, we cover the east side of Birmingham, which is Sparkbrook, Spark Hill and Small Heath. So I'm hoping that many of my listeners today will be from this population as well, and it's really an honour to be here. I've had an interest in perinatal psychiatry for a long time. I have been a psychiatrist since for many years now, but in the last few years I have been doing perinatal psychiatry, and I find it a very rewarding area to work in for many reasons that we can go into as we go further on talking in the show. And I'll talk a little bit about how we can access services, so that hopefully if there's any of you listening out there who feel that anything that we're saying is resonating with yourselves, then you'll feel a bit more empowered after today's show to sort of pick up that phone or to go and see your GP and access that help.
Brilliant, mashallah. That's really good for our listeners. And then I'm going to turn to another colleague we have here, Jamami. Jamami, you're a specialist in mental health, a nurse that is working with your colleagues here, also helping and supporting the communities. Would you like to tell us a little bit and introduce yourself?
Hi Kathleen, it's lovely to be here. Yeah, I'm Jamami Trivedi, so I'm a community mental health nurse, Kathleen. I've been with the team since January this year. Prior to joining the perinatal team, I had a background for 6-7 years working in CAMS, so child and adolescent mental health services. And I guess for me it was kind of like a natural progression going from working with younger children into perinatal. It's an area that I've been interested in for a very, very long time. For me, it's just really good to see that there's a lot more money going into a really important area which has been underfunded really in the past. Our service is very, very busy. I'm working in East Birmingham with Dr. Ahmed. I'm one of 3 community psychiatric nurses.
With the barakah of this blessed month in Ramadan, the message will spread across much more than what we think. So we're so glad that we have you here during Ramadan to be able to get that message across. What first comes to my mind that maybe listeners may want to know is, what is perinatal mental health? They've heard, we know what mental health is, but this word perinatal, what is is this? Why is it relevant to them?
Perinatal mental health is basically mental health disorders which are occurring in the perinatal period, from the point of conception, in fact, right up until a year afterwards. And there is a whole range of mental disorders, emotional difficulties that can occur in the context of this time period, because it's a time of huge change. If you think about it, the number of changes a woman is going through at this point in her life, there will be all kinds of hormonal fluctuations, bodily changes, biological changes, and then there's a huge change also in lifestyle as well, especially once baby's here. So all of a sudden, this, especially in first-time motherhood, mother will often find that for the very first time she is responsible for this small baby who is dependent on her for her needs round the clock all the time. So this overwhelming sense of responsibility can sometimes act as a risk factor for developing mental health problems, alongside all the other things like sleep deprivation. So obviously sleep patterns can get very, very disrupted around this time. There can be health changes that come to light. There can be all manner of things, and also the way it interacts also with the whole family as well. So the introduction of a new baby into a family can alter the family dynamics, it can alter the marital relationship, and hopefully ultimately these are all very positive things, but it is a huge transitional point in a woman's life cycle, and that means that this particular point there are many, many risk factors which can lead to a perinatal mental health problem. And studies have repeatedly shown that it's very common. The statistics would say about 1 in 5 women will experience mental health problems in the perinatal period. We know that they're underdiagnosed at the moment, so we don't... historically, we haven't been seeing enough women. We haven't been seeing all these women. And hopefully with the development of the new teams and the teaching of primary care colleagues and health visitors and midwives, we'll be able to pick more of these women up and treat them accordingly, because it would be a real pity for people to miss out on that treatment. Would you like me to go a little bit more into sort of like the specific types of perinatal mental health problems, or should we talk about that later? What do you think?
Sounds really good. Let us explore this a little bit more then.
Yes. So there is a huge range of mental health problems and emotional difficulties that can affect a woman at this point in her life, so ranging from very sort of mild problems or just some minor difficulties with anxiety, to ranging to the most severe end of the spectrum, where you can get something called postpartum psychosis, which is actually a psychiatric emergency. It's important to recognise there's a spectrum, and our team specifically will be working with the moderate to severe end of the spectrum. So our service will be seeing women who are suffering from the more sort of moderate to severe types of depression, bipolar disorder, really sort of OCD, which has become quite difficult, post-traumatic stress disorder, as well as the normal postnatal depression that we hear about, and the postpartum psychosis. However, we are also delivering training, like I was saying, to GPs, to midwives and to health visitors, so that actually it doesn't have to be a severe problem necessarily for to access help. There will be help at all levels. There's a variety of things that we can do for each of the different problems that we encounter,
which is really important, because sometimes parents don't. There's some very simple, we might say, or things happening to get parents out of the house after having a baby, and some cultures may say, oh, you need to stay at home more and rest, and others may say, no, it's okay to go on out, and there's a lot of variety of understandings after having a baby there. But it's important to have some things to go to, maybe even just walking in the park, buggy walking and things to get out of the house.
Yes, so
to be able to meet other groups.
Yeah, I think absolutely. So, like you said, the help can be at a more basic level, and then obviously when it comes to the more moderate to severe end of the spectrum, then there are things like medication and also psychological therapy. Psychological therapies actually can work across the spectrum. So, and that we have different levels of psychological therapy for each of the different sort of like grades, I suppose, of mental health problems. But like you said, you spoke bit about the culture, the cultural expectations, I think something that's really, really important to highlight today, and I think a message I really want to get across today, is that mental health problems can affect people of all colour, creed, religion, and it's really, really important to recognise that, you know, it can affect anybody from, you know, there's no class differentiation, there's no cultural differentiation or religious differentiation. It can affect absolutely everybody. What we do find, however, is that particularly people from ethnic minority backgrounds, so people from Indian, Pakistani backgrounds or any kind of minority backgrounds, sometimes the level of awareness can be less. It's there is less of a concept of mental health problems sometimes.
So, yeah.
Less of recognition.
Exactly. It's hard for them to understand this. And Elizabeth, I know we introduced you as Dr. Elizabeth Penny, but we should probably tell our listeners that you actually are a Muslim because they can't see you in front of them, indeed. And you've got a lot of experience of working with the Muslim community.
Yeah, and when you were speaking, Saba, I was thinking about how important the perinatal period is within our religion, actually, you know, and actually seeking help when you're pregnant and when you've had a baby is something that's a very strong tradition within Islamic cultures, and Islam recognises how difficult this period can be for all mums. That's why there are things like, you know, the ideas about rest and about getting support and so on within our cultural traditions. So although those traditions can become a bit too rigid sometimes and unhelpful, they are there because people are aware that really this isn't an easy job for women to do, and it's not a job that they can do on their own. And the thing that really I want listeners to be aware of, I think there's two dangers when a woman begins to experience a perinatal problem. The first danger is that she thinks, oh, this is just normal. You know, it's normal to have baby blues. I just need to live with it. And maybe some women feel to themselves, you know, it's a bit embarrassing to admit, or shameful even, because I should be happy. And that happens a lot in our communities, doesn't it? Because you know, Muslims love babies and they really elevate the status of mums, which is great. But sometimes when mums don't feel that they're fitting that, you know, they're not happy. They're not actually celebrating like they feel they should. They want to hide that because they're embarrassed and they think nothing can be done. And then the other side is maybe that feeling that actually, even if I was to ask for help, that help might not be able to understand my different cultural needs. I think both of those two things are real dangers, and they're both ways that stop our communities from accessing the support that actually would help them. And what I want our listeners to know is that mental health teams are not like they used to be 50 years ago. You know, this is not about judging women, judging communities. It's not about taking babies away. It's about offering evidence-based interventions. These are the things that we know work for everyone. The psychologists, the CPNs, the nurses in our teams, the occupational therapists and the psychiatrists, all the different professions will work with women individually. They work with what they know is going to help in the evidence and what works for her. So when I work with Muslim women, you know, I will talk about their cultures, about their families. I might, in fact, just last week, I gave a woman, it wasn't a Muslim woman, it's a Christian woman, but I gave her homework to go and do more praying because that's something that benefits her. I know that her spiritual life is an important part of her identity. And our teams, you know, our teams will support women in whatever works for them. And I think that's the same with our communities now. You know, we need to be aware that there's lots of things that can help you. If you're feeling low, and maybe not so low that you need the help of one of our teams, but if you're feeling low, or you know someone who's really struggling, both with their pregnancy or with their mood, but also with their relationship with their baby, because that's a really important part of a perinatal service. Is we want to make these relationships the best they can be. This is the most important time for a person's development, that first year of their life. That's why the money's in these services. So if we can help mums to interact better with their babies, then, you know, get the help, ask the questions, tell people, you know, when they say, are you feeling okay? Tell them you're not feeling okay, because the support is there and it can really help.
It's so important, isn't it, to do this, because we don't think of that. We don't think of the different facets, the different people out there. And for me, when you were talking there, it's like as if we're all parts of straw. You know the straw baskets, and we're all those different straws, but we're coming together to make a lovely straw basket to contain, to help and to support those families that need it, from whether we're a community organisation and we feed in and work with you and deliver programs, deliver other services to help. So we're one of the straws, to all the different straws here around, to making that beautiful basket to help and support families.
يا رمضان اشتقت إليك بعد فراق طويل يا رمضان عدت إلينا في جو يا رمضان اشتقت إليك بعد فراق طويل يا رمضان عدت إلينا في جو
I hear a knock on the doors of my heart. I've been expecting the very best of guests, ready to test what Eman I intend to express. A blessed month to cleanse the deepest roots of my soul. This is my home and this is my shield. This is the month when the Holy Quran was revealed. Ramadan, a month of pure beauty, a month that truly defines absolute unity. Therein lies the most powerful of days, when the moon shines bright like a diamond's light. When you can strengthen your trust, the day that equates over 1,000 months. Strengthen your iman, refrain from bad and hold back your lisan. I welcome you with both arms. I hope that Allah connects with me by the religious strings of my heart.
يا رمضان اشتقت إليك بعد فراق طويل يا رمضان عدت إلينا في جو اشتقت إليك بعد فراق طويل يا رمضان عدت إلينا في جو عظيم.
We've done a lot of shows previously in the past about the 2001 Credible Days and the brain development, and I think our listeners have heard me saying that if I had another life, if I was a bit younger and I had money, I would love to study neuroscience. I think it's fascinating. All the latest research coming out, I would love to study that. But we all need to be together as part of a team and supporting each other. And you work as part of that team also, indeed.
Yeah,
tell us a little bit about your work and how you support families.
Yeah, absolutely, Kathleen. So I think it's really important, just what my colleagues have said. Part of what we do is obviously sort of like reaching out in the local communities and breaking down stigma, raising women's awareness of sort of like perinatal mental health. I do a lot of work, Kathleen, going into women's homes. So I think that's really important to stress, because I think sometimes women can be quite frightened and think that because we're getting involved that all of a sudden they're going to have to go into hospital, and that can be quite a scary place. But no, it's very different. We go out, myself and my colleagues, we see women women at home. So it's about building up that relationship with women, not only women who have just given birth, but with their families as well. I think that that's really, really important, because sometimes it might be that women are unwell and it's quite difficult for them to actually verbalise how it is that they're feeling, and it's the family members that might pick up on cues before that woman does. We work very, very closely with our other team members. So we've got psychologists, we've got psychiatrists, and we're also very lucky that we've got nursery nurses as well. So it might be that I go out and I see a woman who's on my caseload, and I'm going out to monitor things in the perinatal period and just make sure that they're staying well, and if there are any signs of relapses, that we're picking up on that and that we're acting on that very quickly to help that woman stay at home in the community with her baby. I think we're really fortunate in that we can have nursery nurses come out as well, and they're just such an integral part of our team in sort of like educating women about what's out there in the local community. You know, we're so lucky in East Birmingham especially, we've got sort of like a wealth of resources on our doorstep really, but for some women it's just about sort of like taking that first step and having that confidence boost of having somebody to say, you know what, you're not alone in this, I can go out with you, let's go to a children's centre together, I can support you with that. And it's just about sort of like really sort of like empowering mums really, and just, you know, really helping with bonding and making sure that they're, you know, falling in love with their babies. Yeah.
So we've spoke a bit about what is mental health and what is specifically perinatal mental health. Maybe we could just break it down a little bit on why is it that we are trying to focus on this area. I know we've said about brain development, but can we tease that out a little bit more? Why is this area so important for mum, dad, baby, family? Why are we really putting all our efforts into this service now, this age group of babies and parents after they've given birth or before they give birth?
Yeah, so that's a really good question, and I guess that sort of hits straight at the heart of what we do actually and why we do it. I think there's a lot of information out there about sort of the early years and how this is really, really important in terms of like good mental health for mums, having an impact on their relationship with their baby, having an impact on the bonding. And then this then translates into a more healthy environment for the baby themselves. So then that having a healthy mum will hopefully mean a healthy relationship with baby and healthy environment for baby, and then that has a knock-on effect, and then a healthy child, healthy adolescent. I know it's going quite far forward into the future, but there is something that we call the transgenerational effect. Basically, it's like a ripple effect. If mum's mental health if we can get the treatment at that stage right, then that can have a very far-reaching impact. I mean, just to go a little bit into sort of some of the things that interested me in perinatal health, mental health in the first place. I remember growing up, my parents they're from India, and they moved here a few years before I was born, so they were basically first generation Indian immigrants. So I grew up actually in a community, because when people move here from another country, they often stick together and they have like quite cohesive communities. So I grew up in a community with extended family and friends, and I remember my mum saying sometimes, you know, that, oh, this aunt, you know, she was never quite right after she had her children, and as a child, you know, you don't sort of like, you just take things at face value, you don't really sort of like think about it much further beyond what you're told. But now as a perinatal psychiatrist, I look back and I sometimes think that, you know, there's been other stories as well, anecdotally, that I can think of, and I think that, gosh, those women actually missed out on treatment during those critical years, and it's possible that some of them have, you know, remained unwell and never actually. We know that if mental illness isn't treated, sometimes, you know, those symptoms can carry on for so many years and have a very far-reaching impact. So it really makes me appreciate what we do today and what these teams are like today. So that was, you know, many years ago, and we're so fortunate to have these teams now which can provide that timely intervention for women, which can have a knock-on effect not only for themselves but actually for their children. And
I think that's where we got the funding, isn't it, really? That's why these services are being funded. It's not that the NHS has got masses of spare money and is giving it to us. We've made a very strong case, and the case is, we know that if a mother has mental health problems, for example, significant depression, it's going to impact on her child in the long term. It's going to impact on their emotional health, on their ability to focus, to concentrate, even academically. And so putting money into the really earliest intervention, into perinatal services, will really help our whole country, you know. And so that's why we've got the money, because it works. We know so much more about brain development in that first year, and even in those first few months, the changes that occur through the way that a mum or a primary caregiver relates and communicates with her baby, that's making so much difference. Now, if you're suffering from massive anxiety or depression, it's really hard for you to concentrate on that relationship. And, you know, you want to. These mums, they're really worried. They want to do the best they can for their babies. And we're just giving them that little bit extra support to make sure that that baby develops in the best way that it can.
How can we distinguish those normal baby blues to something that maybe is not quite right and that do need that extra support that you can give?
Maybe we can answer that together. From a psychological point of view, I think partly it's it being quite transitory. So yes, we expect that your mood will be very labile, you'll be up and down, and you might be very tearful for a few days post-delivery. That's really normal, and it's perfectly fine. But if that's carrying on, that's when we would start to ask families to ask questions. And mums and people who are close to mums will know when that's really impacting on them. You know, it's affecting how they're able to relate with their babies, and they'll start to get other symptoms of depression that aren't just about tearfulness and low mood. They may have issues with sleep that aren't even related to the baby. They might have issues with their appetite, not enjoying things they used to enjoy, all of these kind of symptoms. But I would say that it's not a tick list, is it? And if you're any concern, even if you think it is baby blues, talk to the people who know. So talk to your midwife, your health visitor, tell your GP at your 6-week check, because they really need to take those things seriously, and they will listen.
Yeah, I think we would definitely rather that women open up about these things, and even if they think it's just a case of baby blues, really it's good to start having those conversations. And very importantly, we talk about something called red flag indicators, and these are certain signs that can be present when a woman is suffering from an episode of postpartum psychosis.
We're going to have to come back to those red flags indeed after the break. Assalamu alaikum. Welcome back, listeners, after that commercial break. You're tuned in to Unity FM 93.5 here in Birmingham. We are here talking about perinatal mental health, and we have a lovely audience here in the studio where we're really been getting into it quite deeply in the first half of the session, and we ended looking at red flags, and Dr. Saba was just about to tell us about red flags, which sounds really good for us, and we need to know what are the red flags. So I'm sorry I had to cut you off there before the commercial break. So could you continue about explaining what are these red flags that you were mentioning?
Of course. Yes, so red flag indicators are, there's a list of symptoms like a recent change in behaviour. There may be a lot of confusion evident in the mother. There may be agitation, restlessness, pacing around. They may start to develop what we call psychotic symptoms. So this is when people, as an example, there's many things that can happen when people are experiencing psychosis, but one of the things that people often feel is paranoia, and sometimes in some cases they can hear voices which are not there, or see things which are not there, and can have very disturbing, frightening sort of experiences. They find themselves unable to sleep because of the agitation, so even when baby's sleeping they're unable to actually get any rest. And they can, in extreme cases, they can have thoughts of self-harm and suicide, and sometimes these thoughts can be very distressing and of a violent nature. So these are what we call the red flag indicators, and I think if any of these are present, then it's we have to treat it as a psychiatric emergency. I think often the other thing which is really specific to the perinatal period is thoughts about the baby. So this is something that as perinatal mental health clinicians we really have to explore. So often the baby features somewhere in the symptom profile of the mother. So they may say that they feel completely detached to the baby and there's absolutely no bond there whatsoever. And I've had sometimes mums saying things like, I feel as if I'm from the outside looking in, as if it's not really me. So they can have really sort of surreal experiences like that. On the other side of it, they may actually even develop delusional beliefs about the baby, or they may believe that somebody is out to harm the baby's about to come to some harm. They may get very overprotective of the baby, may get very anxious about baby's well-being. And so yes, it's very important to explore those symptoms as well.
So we can see why they're called red flags, indeed, because they are quite red up there, indeed, and quite in the severe range. But and our listeners need to know about this and be aware of this and access treatments straight away and go to a clinician straight away.
I think it's probably worth mentioning here as well that women, when they've just had babies, do often have really strong emotional reactions, and some women will have a lot of fears that they might harm their baby, even if they really don't want to. And I want to reassure listeners that can be quite a normal process, that quite often all of us as mums will have moments when we think, oh my God, what would happen if I threw him down the stairs, or I threw the pushchair in front of a bus or something. That isn't that you want to do that. So we want to kind of reassure listeners, if these thoughts are concerning you and worrying you, then do please talk to a professional. They won't stigmatise you. They're not going to take your baby away. They're just going to help you to make those thoughts less intrusive and upsetting.
And indeed, if they, sorry to cut you, if they want to come to Approachable Parenting, we're also based in Bossall Heath, and have those conversations with any of us, we can get you to the correct professional there and then, if you don't want to go straight, or if you just want to talk to somebody before we come to another professional.
Absolutely, that would be really helpful. So don't keep it to yourself and worry, because that's not going to make anything better. It won't get better just by sitting there worrying about it. If you talk about it, you can really reduce the power of those anxious thoughts.
We tend to do that as women, don't we? Put ourselves down a lot, beat ourselves about not doing things. We want everything perfect. We talked about the home being like a show house.
Yeah, absolutely, Kathleen.
I only went to visit somebody yesterday. I was giving condolences, and they were apologising about the state of the house. Now, saying, I would, like you, I'd be worried if it was a show house again. You know, this is a home. We all live in homes. Homes are places that do get untidy, and we have toys around here and things there. You know, it's not that it's unclean. It's just untidy, and that's what homes are about: playing with toys and taking them out.
Absolutely,
and interacting with children.
Yeah, they're lived spaces, aren't they? And they're shared spaces as well. I just think it's really important, just leading on from what Elizabeth was saying about making sure that women do seek help, and it's about breaking down barriers. But I think there is a lot more awareness, especially with GPs now, around sort of like perinatal mental health. Obviously, there's still work to be done in sort of like educating and getting the message out there, but as we're a new service, a lot of our referrals are coming from GPs, and we're actually getting quite good referrals from GPs, sort of like picking up on what Saba was saying about red flags. We go and see women. I guess part of my job is we go and see women when we receive those referrals within 1 to 2 weeks. So we act quite quickly, actually, and we go and assess women at home. Part of the assessment, we like to do what we call sort of like a holistic assessment. So obviously we're talking to women about symptoms and how it is that they're feeling at the moment, and like my colleagues were saying, it can be a really sort of like broad range that we see. So we can see women that have got sort of like low mood, tearfulness, to sort of like the other extreme end of sort of like perhaps developing some sort of like postpartum psychosis. But also it's really important to learn from women a little bit about them, about their stories, about sort of like their experiences of pregnancy, childbirth, and also looking at the spiritual aspect of it as well. Obviously it's Holy Month coming up. Religion is very important, and obviously the area that we're working in as well. So making sure that we're picking up on that and making sure that we're incorporating that into the work that we do with women and their care plans as well.
Yes, and I'm glad you brought in this holy month of Ramadan, because it is a blessed month for us. And I'm sure the other thing that I was thinking of, which we'll talk about Ramadan in a few minutes, but I just want to include our listeners that are down south, that they may feel a bit excluded because we have all these wonderful services up in Birmingham, and we're always promoting Birmingham, but there's similar services down there as well, and the importance of going to a midwife, going to a health visitor, going to a GP to get that help is also all over the country indeed. So we need to phrase that and make sure that they know that. Yes, of course.
Yeah, and they might have family members or friends all around the country, and we're really at a time of change for perinatal services. You'll find now that most areas of the UK will have some community perinatal team either now or in the very soon future. So that's a really positive thing. So no, it's not just for you Birmingham people.
So which leads us a little bit on though about Ramadan. We've mentioned Ramadan, which is lovely, and blessed month. We're all so excited. First few days, we want to do so many things in Ramadan. We actually set ourselves up sometimes too much tasks to do in Ramadan. What advice can you give a new mum, new dad out there that are going through their first Ramadan together and the things that they want to achieve?
I want to reassure new mums that Ramadan is not just about fasting. This is not from a professional point of view, from a personal point of view, and certainly in my work that I've done with new mums in different communities, and particularly in our Muslim communities. Sometimes mums can feel really left out, that they're not fasting and therefore they're not able to partake in Ramadan, especially if in their first few weeks after giving birth they obviously won't be praying, and they feel that they're missing out on their Quran as well. But there's so much. Ramadan is actually about building your spiritual relationship with your God in whatever way you can build it, and there are lots of ways that you can do that. And I think a really powerful way is by building your relationship with your new child. So that's the job that you've got this Ramadan. If you've got a new baby, you've been given a dispensation, you've been given, a reason not to fast, and that reason is really important. So focus on your relationship with your child. There's lots of other things spiritually that you can be doing, so do those things, the things that benefit you, and remember that this religion has dispensations for a reason. If you have significant mental health issues, then there are reasons that you may not be able to fast at times, and that's not sinful, it's not shameful, it's not embarrassing. Those reasons are given by your Creator to allow you to develop spiritually in the right time for yourself, and in different ways. So please look at all the variety of things you can do with your month. Cook for other people, give charity, do dhikr. There's so many other things that you can do to make sure that you're part of the community in Ramadan, even if you can't fast.
And you'll have that reward from Allah for your intention of doing things.
Absolutely.
Even if you're not able to do it and you're just intending to do it. Yeah. It's such a beautiful faith that we have those rewards and coming closer. And as you mentioned, even just thinking some dhikr indeed to build your relationship will help you. We don't need to be doing everything. And I'm sure you've come across a lot of Muslims that are on medication, probably ask you about medication and fasting and during Ramadan. What advice can you give for those patients that are querying these things?
Yes, I would say definitely to bring it up with your psychiatrist. So there are things that we can do. A lot of our medications are once daily dosing, so we can advise you as to the best time to take that, and how to actually structure your days around taking the medication at the right time. So I think it's definitely a conversation which is good to have. I think, like Elizabeth was saying, it's really important to remember that, at the moment particularly, the fasts are particularly long, and I think there's a fair amount, especially for women in the perinatal period, it can be quite difficult, and it's important to acknowledge that. And while I think Ramadan has so many positive benefits to it, but it's also important to acknowledge those situations where it might be that bit too much difficult for a woman to do. So I think that does not mean that a woman cannot take part in all the in all the community spirit and all the spirituality benefits that happen during the month, and but also even if she can't fast, she can take part in all of those things. So I think it's really important to remember that. But for women who can fast, that's a really good thing, and to definitely have a conversation with your psychiatrist about when to take the medication, also to make sure that you keep your hydration up. So there is a window, I think it's around about 6 hours, 7 hours at the moment. So to make sure that they have enough water to drink during that time, and make sure that they're keeping their nutrition levels up and getting adequate rest as well when they can. So I think it's all about that, and just sort of thinking about how they can, structure the day so that they can get a little bit of, put their feet up during the daytime and things like that. But also putting it all in the context of the fact that maybe this is a new mum who's also just given birth, so recognising all the stresses that the body is under, and all the extra stress that it's going to be under.
And we have that compensation, as Elizabeth already mentioned there. And some mums unfortunately feel very guilty about this, especially maybe if there's their first Ramadan after having a baby and enjoyed the community spirits previously, that they're not feeling involved. But there's lots of other things they can do, lots of things that they can help with, lots of conversations they can have. They can come to us in Approachable Parenting. We're actually going to be doing stretching kind of movements one day. So it's not yoga, it's not. So we're keeping it very low key so that parents can come in, whether you just had a baby or you've had older children, and just take part, meet other parents and talk together and have some stretches in this time.
Like all the community benefits that we were talking about. And I think the spirituality aspect of it is something that is really, really important as well. And there is more and more recognition nowadays of spirituality being a really important part of a psychiatric assessment and really addressing that in treatment and recovery programs as well. So I think, like you were rightly pointing out, women can experience a lot of guilt, if they're not fasting. And I think that's something that, that they should be able to talk about. And, we do have many people in the same situation. We do have people who can advise. And I think it is definitely more on the radar now of clinicians to actually address this.
Yeah, I'd just like to say, Kathleen, just leading on from that, I went to see a lady that I've been working with for a few weeks now. I went out to see her last week. She's of Muslim faith, and she was getting incredibly distressed, asking me, what shall I do about Ramadan? Will I be safe to fast or not? And it's really, we give advice, obviously, based on discussions with our colleagues and, MDT discussions, but it's really based on that, on the individual. So, I've got lots of women that I work with that are from a Muslim background. Some women might be in a place at the moment where they're well, both physically and mentally, they're feeling a bit stronger, and we think, actually, okay, if you want to do that with advice, that's fine. What we wouldn't want is for women, when Ramadan are coming up, especially if they're on medications, to decide to sort of like come off their medications because they want to sort of like partake in fasting. So we always advise women, if they're unsure about, if they are taking medications and they do want to fast, just to get in touch with their GPs, health visitors, if they're under mental health teams, just to pick up the phone and have that discussion, because we wouldn't want women to be missing out, but we just want to make sure that women are safe in obviously what they're doing.
Brilliant. We do want all women to be safe there together in this.
Ramadan, 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 Ramadan. The blessed month has dawned upon us with its merits and blessings combined. In it the Quran was revealed to Muhammad. Peace and blessings be upon his soul. Ramadan, 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 Ramadan. Without Eman being uplifted from reading the Holy Quran and the joy of breaking our fast every day, oh blessed month of Ramadan. Ramadan, 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 Ramadan. Spirituality in the true essence fills our daily lives. With the call of prayer we gather, for the mercy of Allah we strive. Ramadan, 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 Ramadan. Giving zakah and a sadaqah to the ones who are in great need, helping them to build their lives again. For them happiness let us all bring. Ramadan, 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 Ramadan. Every moment, every breath, we thank Allah for giving the month of Ramadan. Alhamdulillah, for giving Islam as our deen. Alhamdulillah, never forget to say Alhamdulillah. Ramadan, 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 Ramadan.
As we're coming to the last 5 minutes of the show, and I know we have a lot to talk about, maybe we could give some tips around and summarise some of what we're doing around with tips for people that are tuned in to us that have just had a baby or about to have a baby. And maybe there's some people that are pregnant that are tuned in and want to do one of our parenting courses. We will have them after Ramadan in Women's Hospital over evenings, weekends and daytime. So if you want to contact info@approachableparenting.org.uk or contact us and we can get you on one of those courses that are coming up in Women's Hospital indeed, so to be able to prepare for birth.
Preparation is really important, isn't it? And you may feel busy in pregnancy, but believe me, you'll have a lot less time when baby comes. So do try and be prepared. But what I would, and organisations like Approachable Parenting will give you a really lovely, balanced perspective and not tell you what to do, but tell you to follow, give you some tips in following what's right for you. And this is really important. Psychology has gone kind of from one extreme to the other in terms of the advice that they'll give mums. But we're really in a kind of middle space now, and this is where our deen is. You know, Islam is a middle way. We are moderate in what we do. So when you'll see advice from so many different people. You'll have one advice from your mum, one advice from your auntie, books telling you something else, the TV says something different. You are a mum now. Your instincts will tell you about your baby. Look at your baby, see what she or he is trying to tell you, and you'll make some mistakes like we all do with communication, but keep following your baby as much as you can. Follow your instincts, try and be moderate in what you're doing, and you really won't go wrong. When things go wrong, it's because people are unduly influenced by loud voices around them and not comfortable with what they're doing. You know, and that can be a real problem with our parenting. Take it easy. You are not going to be perfect. None of us were perfect mums, you know. Even Kathleen, she was great, but she's not perfect.
I can tell you a lot
and
of things.
And I'm certainly very long. My kids will be phoning in if I'm not careful, giving examples of how unperfect I've been. It's a very difficult job. That's why it's rewarded so much in Islam. It's hard. Don't be too hard on yourself. When you see all the social media pictures of everyone else having perfect family time, trust me, they're not. You know, we're all in this boat together. It's difficult. We need our community around us. Find the people who are going to support you. You're not the people who are going to judge you. Get the support that you need.
Wonderful advice, and it's not just like your first baby that you need this advice. I was just thinking as you were talking there about number 2, 3, 4 down the line. That challenging child that you weren't expecting, and how am I going to cope now? And something that comes out of the blue that you weren't expecting about your own health. So we need do ask for help then. You know, if it's something that is different to previous pregnancies, to previous way you're feeling, do come early and ask for help. And do you have some top tips for us before we end the show today?
Yes, so, like Elizabeth was saying, be prepared, but at the same time, don't set your expectations too high as well. I think that can become a problem in itself, and having too many perfectionist sort of, idealistic expectations of what motherhood should be like, that can actually cause problems as well. So I think it's about, going with the flow and being a bit relaxed and recognising yourself as an individual, and recognising that's what we help people to do as well. We help them to identify, get to know themselves really, and kind of really tailor that that management plan according to the individual. So I think that would be one of my tips. And the other thing is just don't suffer in silence. I think that's really, really important. There is help out there. It would be such a pity if people just suffered like they may have done. We're living in a time when perinatal health services have really expanded, and that recognition has really grown, and that's an amazing thing. So make use of it.
Yes, we're all there. We're there together. They're coming as individuals. We're all actually individuals here. I think a lot of us are mums in this room together, and we've experienced it ourselves. Yeah, we've had the ups and the downs, and sometimes we are our own worst enemy in putting expectations on ourselves. So I'm so glad that you mentioned that.
But especially in the Muslim community, I really resonated with what you said, because they elevate the status of a mum so much that mothers feel that their job is to just sacrifice everything of themselves for their babies, and that's not healthy. In the long run, you need a little bit of time for yourself, a little bit of your own space. Otherwise, how are you going to be the best mum that you can be?
Time to recharge your batteries. You got some recharging batteries for mums there that they need to relax and recharge.
Yeah, I think I just want to echo what sort of like my colleagues were saying. Really, it's about sort of like not having these expectations to be a perfect parent. And I think if you look on sort of like social media as well nowadays, I mean, I don't know about sort of like the Kardashians and all these celebrities, I think there's so much pressure there on mums to be the perfect parent, and it's not about that at all. It's about following your instincts, listening to yourself, like my colleagues were saying about looking at your baby as well, and just real sort of like common sense stuff as well, and making sure that women are looking after themselves in terms of sort of like their diet and wellness, getting out and about, making use of sort of like local parks, local groups and stuff like that, getting out and talking to other women. I think there can be a lot of pressure, especially on Muslim women. I'm from a family myself where my dad is Pakistani, so I know sort of like extended family pressures that can come from women sometimes as well, and advice can be conflicting, and it can be a really difficult time for mums. But I think just follow your heart, get support and advice out there, and there's lots of people out there, sort of like ourselves and sort of like from primary care as well, that can offer lots of support and advice.
Wonderful. Lots of care, lots of advice out there. Even if you're in Birmingham or down the country, there is support services there all over the country. So, and this programme actually will probably get repeated, and sometimes people pick up on it even abroad. So just before we end, and just in the last minute or so, if there was somebody that's tuned into this that wasn't from the UK, is there any way that we can give them little tips or advice?
I would say don't keep it to yourself. That's the one thing that will never help. If you sit there feeling ashamed and upset, it's never going to get you better. Seek help, and that will be different in different places, quite possibly through similar system midwives or GPs. But keep asking until you find someone who really understands what you're talking about. Get support from your community and your family, but try and find professional support as well. There are resources on the internet, but make sure you're looking at reputable organisations, not at just any old random chat from other mums, because that can be a bit more confusing.
That's wonderful, and we have a great team here in Birmingham. I'm sorry, listeners down the country, or if you're tuned in abroad, that you mightn't have the same service we have here. We're very lucky, alhamdulillah, to be in Birmingham, that we have you as professionals here, caring, wanting to engage with our community, want to make a better place for everybody, for all the mums, all the children. Alhamdulillah. Alhamdulillah. Thank you so much for coming in today, Jazakallah Khan, for coming and giving up your time and explaining this special period for parents. I hope after this that they will engage more with us all as service providers and helping them, inshallah. And listeners, we wish you a very happy Ramadan, inshallah, a very blessed Ramadan, inshallah, and may your families grow closer together in this special time and special month, inshallah. We hope to see you next week for another show of Parenting Hour. If you do want to come on to one of those parenting programs, as I said, do give us a ring and Approachable Parenting, or send us an email. We'll be running them after Ramadan, inshallah, in Women's Hospital. And until next week, have a blessed week, and remember us all in your dua, inshallah. Assalamu alaikum.